here. I'm in an amazing setting. I'm in Mexico City in the Ophthalmo University campus, surrounded with technology. We're going to talk a lot about technology today. And look, I was making a joke, right? I'm using an ingenuity to present some slides. What do you guys think? Huh? It's a cool thing to do. So we're going to give a couple of seconds more, and then we're going to start. For me, it's an honor to be part of this webisodes. It's going to be a series, as you can see there. It's going to be 4 webisodes connected one with the other one with a new perspective. We're going to talk a little bit about this in the future. The second important thing I want to talk about is about that word in yellow, the community. We are part of a community. The entire, ecosystem that moves around eye care, we need to be a community. We need to be united. We need to understand that we have tools that we can improve our practices and the quality of life of patients. So I want you to all the time see yourself in this webisode as a community. This is the structure that we're going to follow today. We're going to do a 5-minute show. We're going to talk a little bit about, what is happening actually here. Then we're going to have some gamification. We're going to do a mask event. You're going to see, in this episode, we're going to see a clinic. You will not know which clinic is, and you will need to guess. The second module is about academy and evidence. We believe evidence is very important so we can improve our practices. We need to know what is published and what is good data. Also, we need to know how to communicate and how to educate our patients. And we're going to talk a lot about that. And we think it's very important in our practices nowadays. And of course, in the end, we're going to unreveal the mask of the clinic. Okay, so welcome to the 5-minute show. The first thing I want to say is the huge team that is behind this. It's interdisciplinary. There's so many people. If I start listing those people, I will not finish. There's people from academy, from industry, from branding, marketing, designing team, but also technicians, software, and we have 2 amazing things that are the ambassadors and the translators I want to talk about. The first thing is this is not behind the scene, this is in the scene. As you can see, this is kind of historic to have 6 languages, but real time. We have Dr. Imane Tarif translating to French, Dino Lanker to French to German, Cesar Villar to Portuguese, Dimitri Martinov to Russian. Julia had a little problem, so we're going to lose Italian today, and lose Marina Melo to Spanish. So we're very happy that we can reach so many countries. The second concept we're using for this event is the ambassadors. And as you can see there, probably Dr. Waldi is very happy, right? Because all the roads go to Rome. But what we wanted right here is for you to understand that we have one ambassador for every single country in Europe, talking about their realities, talking with their societies. So we are connected with every single country, with young surgeons who are starting their careers and want to share something with us. The second important thing about the 5-minute show is the survey. Everybody who can, take a picture from that QR code, we will love for you to answer a quick survey of 5 minutes, and we will put it there, just only 1 questions that we're going to talk about. For example, in this case, which are the barriers for advanced technology IOLs? In this case, we're talking about trifocals and toric, and there is many people telling us that the price or the patients cannot afford them are some barriers to implant that. That's what we're going to discuss. So for everything you answer in the survey, then we're going to discuss it right here with this amazing panel. This year, Ophthalmo University, that it's a big community, has this mantra, is to add value for your time. So today, every time we open our mouth, is to give you something or knowledge or a tool for you to add value to your time. We know that your time is limited, so we want to add value to it. So I hope you can follow us in social media. We're very active and always giving you tools. This is one of my favorite slides, and I think this is what makes this event possible. Here it's academy and industry working together. In this case, we have an amazing organization like ESASO that it's helping us to spread our word through Europe. We thank ESASO a lot, and especially the Alcon Experience Academy, the branch from Alcon to do some education. It's helping us look at this technology, right? We couldn't make it without industry. So my opinion is we're going in the same direction. We have the same goal. We want the best for our patients. So then why not, to be together in this matter and try to collaborate. Shemaine Lebesky is here with me, and Shemaine, thank you for being here with us. You have been part of all this event. I would like some words from you.
Thank you so much, Ivo, to you and really to the whole team at Ophthalmo University. It's really been amazing to have the Alcon Experience Academy sponsor this event, also working with ESASO. It's been nice to have, as you always talk about, academy and industry working together. This is going to be an amazing series into your patient's view. And I think today is just a little glimpse of it. And I think as the weeks build over the next couple of weeks, we're going to really talk about that patient's journey. So I did want to say a special thank you to all the translators. It's amazing and really epic that we're able to have so many languages simultaneously translated. So a big thank you to them, as well as the amazing key opinion leaders that you have here that Ophthalmo University has gotten. So thank you so much, and I really can't wait to learn from everyone.
Thank you, Shemaine. Thank you so much for your kind support. And again, we have 3 organizations with the same goal, with the educational goal, and the objective is pretty clear. It's skill and knowledge transfer. That's what we want today. This is only about you, but with one thing. Here, we want a new perspective, as I said in the beginning. Let's see what that patient in the slit lamp is thinking. We see so many patients in one day. We have an amazing panel that they are in their clinics. They saw what, 30, 40 patients today. But what is he thinking? Are we communicating with them correctly? Are we offering them the best technology available for their situation? I think today that's the main objective. And the people that knows me, I'm crazy about sports and about high performance. And this, it's an amazing quote, not from Michael Jordan, but the guy from behind in that image, the guy who trained him. He will say that you are as good as the tool you have chosen, and the ability to use those tools in their maximum potential. So today we're going to talk about these 2 amazing tools, and let's see if we can understand those tools and use them in their maximum potential. Maybe they will help us to differentiate ourselves, and maybe they will help us to give our patients a better quality of living. So again, we want to improve your practice. We want to give you tools. And just to finish, remember that there is 4 webisodes that are completely connected, and we will love for you to be with us. This is the number 1. Number 2 is going to be 11th of March, 18th of March, and 25th of March at the same time. This is webisode number 1. Look at that panel. I'm so happy to share the screen with the great Florian Kretz from Germany, a very good friend and amazing surgeon. Luis Fernandez Vega from Spain, also a very close friend, a very good surgeon, very good communicator. And Karen Dursey from UK. Thank you, Karen, for being here with us. Dr. Luca Gualdi, also we met a couple of years ago in Brazil, an amazing meeting. It's an honor to have you. And Dr. Osana Muraru, thank you very much as well, from Romania. I'm pretty sure he has an amazing point of view of technology. And webisode number 2, I'm not going to go for every speaker, but you can see them from yourselves. But again, in episode number 2, we're going to have a masked surgeon talking about pre-op. It's going to be very interesting. In webisode number 3, we're going to have surgery. You know, people get excited with surgery, and we're going to have 3 masked surgeons that they're going to do an amazing job and a cool panel to discuss about it. Episode number 4 is going to be post-op. This is going to be very important because after everything happened, we're going to see how you talk to your patients and how you communicate everything that happened, right? Again, I hope you can enjoy the panel we have. It's an amazing panel. We're going to try to do it in a very dynamical and practical way. So let's start with the second module. Okay, guys, so now you're going to see a video. Okay, we're going to share a video. It's going to be a short video. It's going to be a video from one clinic that we're going to do our best for you to not know which clinic it is. And we're going to have the panel, and I will love the panel to discuss a little bit of everything that happens in this journey. Okay, let's put the video, please. There you go. Very good. So everything starts with the web presence, right? There you have a little bit of, maybe if you look really carefully, oh, there you go. Maybe you will understand from which clinic it is. But since we're talking about the web presence, let's see Dr. Luca Gualdi. How do you manage this in Italy with your patients?
The patients see on the net and find the clinic, or sometimes by speaking with other patients which had the consultants or operations, and they are happy for the results. And speaking with them, they give the name and the telephone number of our clinic.
Very good. So now we see the patient getting into the clinic. You know, we are in a COVID area. Dr. Moraru, tell us a little bit about which changes you did in your clinic in this specific matter.
We set the chairs in the waiting rooms apart. So we have now half of number of chairs in the waiting rooms. So we also schedule the patients in more in a fashion that they don't meet too many in the waiting room. So this is before the consultation. And also we have plexiglass things in front of the young ladies from the secretary. And we try to keep as much as possible the distance between the lady from the secretary and the patient, between the nurse and the patient, and at the end, between the doctor and the patient. For example, we don't use this device at all. And I don't think it's suitable for this COVID era. We try to of course, we have all the doctors and have masks. The doctors, the nurses, the patients have masks covering the nose and the mouth. So this is what we changed a bit during this COVID era.
Kyron, there is many points of contact here with the patient. Tell us a little bit more about what you do in your private practice.
Look, so it's just safety first. So we send clear instructions to the patients so they can really understand what they're going to expect before they actually arrive in the clinic. And we're just developing videos for that now as well. And then when they arrive, then they can just follow through. And we do exactly the same, staggered arrivals, so patients aren't sitting waiting. But then also separating out machines as well and put gaps and spacing between all the machines that actually people aren't ever sort of even meeting in corridors, ideally.
Excellent. Excellent. Now we're doing some studies, we're doing some pre-op studies before we're actually seeing the patient in the consult. Florian, tell us a little bit more about what you do in your private practice.
We changed the whole patient flow from the very beginning. We started with like a self-service desks with video cameras where the patient can sign in themselves. We reorganized the whole patient workflow, and we even tried to change the walking routes through the clinic for the patients. But the main thing we did is we optimized the time a patient spends in the facility. So for example, for intravitreal injections, patients on average only spend 15 to 20 minutes in the building, including getting the injection. For cataracts, we are down to a total time in the building of 30 minutes from coming in, signing in, coming in the OR, getting the surgery and leaving. And with that, we created a very high patient flow with a low number of patients in our clinic. We separated all the chairs. We, like you can see here in the video, have plexiglass shields. At the reception, everybody's wearing FFP2 masks. We open all windows every 20 minutes. So basically that's all or most we can do. We still perform studies and we still have ongoing studies. So for those patients, if they can't afford it themselves, they get FFP2 masks from us. And we also try to change the staff. So one person is not longer than 25 minutes with one patient. And that's about what we have done so far. And it worked very well. We did not have to close. We have no case of COVID in our clinic. And because we live in Germany, we don't have any vaccinations yet. So it's still working. But it's a good workflow. And I think that's the key benefit. You need to improve for your own measures and for your own setup. There's no system that works for everyone. So you really need to analyze it closely and see where can I save time? How can I bring patients to easily? And we do phone consultations now as well. Some patients come for an examination and then the consultation is by phone or by video call afterwards.
Florian, what percentage of patients are video call patients in comparison to the ones that you see face to face?
Oh, it's only 5%.
5%.
It's a very small amount. Usually it's like the premium IOL consultations that need a second or want to have a second talk, or follow-up visits for glaucoma that come every 3 months usually. So they just come in, get the IOP measurement or the visual field, and then they leave, so they don't have to wait. Yeah.
I think we lost Ivo and all the Mexican team.
I have a question for Florian, if there is a bit of time. For example, with the patients for premium lenses, you just said about the premium lenses, it's we need to have a more extended discussion with them, chair time. How can you manage with this longer discussion with premium lenses patients if you want to have them only less than 20-25 minutes in your clinic? Did you find a way to do this?
Yeah, most of our patients get the information sent home now. We are going to start an app next week where the patients can sign in and get the information and can see videos about different IOL, different technologies. The time that we can't reduce is our pre-op measurements and the pre-op counseling with the optometrist. So here we have one person doing the measurements, taking approximately 25 to 30 minutes, and a second person later on who only does 25 minutes counseling with the patient. Our doctors don't have long discussions with the patient, so our average time with the physician is only 6 minutes. But that's just because the optometrists do the work beforehand. And if it takes longer, then usually it's a case where the patient wants to think about it. So we give the patient the information and send them home, and then we do the video call, which works very well usually. And then they get the documents sent, sign them, send them back, and get an appointment for the surgery.
Okay, interesting. Thank you.
Hear me here? Can you hear me?
Yes.
Yeah.
Yes. Yeah. we lost you a little bit, but the discussion was amazing. So that's exactly what we wanted. Here, after the video, we have an amazing picture from Dr. Waldi in his clinic. As you can see, there is a lot of technology and there is a screen for patient education. Tell us how important it is for you patient education, Luca.
Yes, very important, because the patient really doesn't know what they have. So if you explain with pictures, samples, or just, for instance, topography or tomography, to see the astigmatism, to explain to him which lens will implant. Or also for the cataract, we do a lot of anterior OCT, also of course posterior, but to explain in the narrow angle or swallow anterior chamber, very small. Sometimes there are people with hyperopia of 2 diopters at 55, 60 years old, which ask for refractive surgery with laser. And sometimes doing, for instance, an OCT, anterior OCT, we see that the angle is almost closed, and we explain them that with this operation of, for instance, a clear lens extraction or cataract, if they have a small cataract, they will also prevent glaucoma. So they are very happy to see technology explained by each case. And of course, with maculopathy also, we can explain with the posterior OCT or with the picture of the fundus or retinography. Sometimes without dilating the pupils, sometimes just for screening, we can see the optic nerve, the vessels, to explain to the patient's hypertension and so on. So for me, the eye imagination, like a video to explain the patient, is very important, because we explain also for instance, we have the eye, we open the eye, we explain the cornea for the refractive surgery, the pupil, and it's very important patient information.
Excellent, excellent. So in the video, we saw a journey. We saw many points of contact. Florian was talking about time and the importance of efficiency and processes. Luis, probably that clinic is a little bit familiar from you. Tell us a little bit about that video, what you saw, how is that process important to you when you see a lot of patients?
It's just a little bit familiar, Ivo. So well, we do some things that you saw in the video. We have very well organized all the patient process, because we think the patient journey, as the title of this event is called, is very important. It's not only the final result of the surgery, it's also very important all the journey for the patient. So for us, as I think Florian or other of their colleagues said before, the optometrist sees the patient before us, and the optometrist has a very well-known protocols for them, and they know which test they have to ask. So when the patient comes to the clinics, we know we have exactly all the tests that we were looking for. Only in 5% of our patients, the patient has to go out of the clinic to do an extra test because we are missing something. And I think that's very important to have all the info and to be able to plan the surgery.
You can see, guys, here in my screen, this is one of my favorite slides and comes from an amazing clinic, and I will let Florian explain everything that happens in his clinic, especially that image from the bottom left. Florian.
Yeah, we try to interact a lot with our patients. So because we can't host our patients anymore after the surgery, each one of them gets like a paper bag. And in the paper bag usually is like waffles or a sandwich, and they can choose what they want to drink. So we do offer them our own brand beer. We have sparkling wine for them or water. And then they get sunglasses after each intraocular surgery as well. Normal ones for cataracts and refractives, they get some with unbreakable glass in front of it. And it works very well. The patients are very happy. Today, for example, we had patients traveling by bus. So there were two like big buses with 12 patients each that came. So they can be separated because of COVID inside them. And they had like 2 hours drive one way. So they were very happy to get something for the way back, having something to drink and having something to eat. And it's very well accepted. And it's just like, for us, it's a little bit giving back, because in the past we had like a little mensa where they got a drink, or a wake up room where they could at least rest a little bit after the surgery. And we closed it all down.
Sí, pero igual no en toda Córdoba tenés esa posibilidad. En el Cerro, por ejemplo, estamos
Very
viendo
good. Very good. We're going to show and then another image, a very important image. This is Dr. Moraru in her operating room. And we think it's very important. We're talking about the clinic, but part of that experience is the operating room. As we can see, you're very efficient. You have 2 patients, and patients also in surgery, they care about many things, like if they were cold, or if there was some pain, if the person who bring it to the operating room treat them correctly, right, Dr. Moraru? Tell us a little bit about how you care about the patient journey in the operating room.
As a matter of fact, we have 2 ORs. This is one of them. And the second bed there is, and me sitting at the microscope. So I'm at the end of one of the surgeries, and the other one, the patient here in front of the picture, is prepared by a nurse with disinfection of the eyelids and so on. So it's only one surgery, and the second one is prepared for the surgery. Of course, we have in pre-op room, we have the patients. They used to be several, but now there are 1 or 2 because of COVID conditions. And we have about 8 nurses in our OR, in pre-op area and in the OR, and 7 and 1 in the sterilization room. But the nurses talking with the patients are 7. So 3 in pre-op area and 4 in the OR. And yes, we talk with the patient, we explain them that we perform all the cataract surgeries and most of the surgeries, except for corneal transplant and the VR surgeries, of course, we do with the topical anesthesia. So the nurse is the one who explains to the patient how the surgery will be, how he or she will feel, what she will feel. She or he will feel no pain, and so on. And also the nurse also prepares with the mydriatic drops. And when the patient is brought with on a chair, on a table with wheels, of course, directly under microscope, there me, the doctor, the surgeon, discuss again with the patient and tells him or her that she has to look in the light. So we try to calm down the patient. The patient usually stay really very calm and relaxed during the surgery. For example, at the beginning when we prepare the eyelids and so on, we explain every step of these maneuvers that we do on his or her face or eye. So they really stay relaxed. So, and after 10 minutes, the surgery is ready. So they feel quite comfortable. After the surgery, they stay in the post-op area, no more than 5-6 minutes. And after that, they go home.
Very good. So here, you're going to see us
mathematics
coming to the second segment of the webinar. The first thing was talking about the journey, to talk about everything that happened, those points of contact with the patient. But now with this amazing team, I just did a little bit motivation, but these colleagues, Jaime, Jason, Pablo, and Oliver did a lot of work and a lot of research just for you. We believe science can be very cool and very exciting. So we follow this path to ask an important question, do a very, very well-designed search of evidence, of course, evaluate it, take conclusions, but especially to share it with you in a very cool way, you can say. No, I think science could be very cool. Jason is here with us to tell us a little bit more and ask the panel about the questions of 4 interesting things. Jason.
Hi guys, how are you doing? It's great to be here. Just like Ivo said, this whole process is important to follow, and I'm going to share my screen with you guys now. I hope you can see it. There you go. So the 4 questions we're talking about today are the surgical indication, the outcomes, the safety, the patient's safety, and what the satisfaction for the patients are. Pointedly, we want to know when is the right time to go into cataract surgery, how safe modern cataract surgery is, how good is it today, and if patients are actually satisfied when we do this. So to do this, we start with a PICO strategy, and you can see what our population, intervention, comparison groups, and the outcomes were that we were looking for. And what we did is that we went through almost 3,200 different records that we classified, and we were looking for randomized controlled trials or higher levels of evidence published during the last 3 years, and we added some relevant references. So after we identified these 3,200 records, we screened about 300 of them, and then did a full text search on the last 100 or so. So going back to our questions, I would like to ask the panel, when is the right time to go into cataract surgery? And maybe I'll start with Dr. Moraru. Can you tell me a little bit of when do you indicate surgery for your patients?
Well, we tend to recommend the cataract surgery in early stages, if it's possible. Unfortunately, in our country, people come quite late to the surgery. We have almost every day, we perform surgeries every day. We have almost every day at least one or maybe more patient with cataracted hand movement, for example, or count finger or light perception. So very advanced cataract, unfortunately. But
if you could choose, what would be the visual age or visual acuity at which you would go for surgery, if you had to choose it?
It's depending on the patient's age and lifestyle and job and so on, because some patients are not happy having 0.8, for example, a central subcapsular cataract could influence the visual acuity, could impair visual acuity in a patient who is active and needs a very good visual acuity. So in this case, I would go for cataract surgery, even if it is 0.8. In some other cases, if people, for example, come from countryside and they are not bothered for a vision like 0.3, 0.2, it's okay to recommend them. In our country, it's a special situation because, and I'm working in private clinic, so it's also a matter of costs and money. And some of the patients, especially in this sanitary and economic crisis, they tend to postpone a bit the surgery. Yeah.
That's fantastic. It's fantastic to know that you take into account more than just the visual acuity to go for surgery. Dr. Kretz, what else do you take into account besides the visual acuity?
I don't take visual acuity into account.
Don't take it into account. So
no, I take patients' problems into account. We ask them for light phenomena under dim light conditions, nighttime driving. We ask them if they can feel that the visual acuity has gone worse. We have patients that come to us for years, so we can see if their symptoms of visual acuity. I'm looking at a decrease of visual acuity, a decrease of vision quality rather than just visual acuity. And then it's basically the problems the patient has. I just did surgery to a patient who had a vision of 20/20, but he landed with 20/10. And you could not really see any opacification in the lens. It was just in the eye trace that we found changed aberrations of the lens. And so, and he had problems and described his vision is going down. So we said, okay, we tried the surgery and he's very happy.
So that's fantastic as well. what the evidence says right now is that we should have surgery once life is affected. For many years, the tradition is to try to settle on a visual acuity, but the reality is once life is affected, you need to go for surgery. So
Exactly.
that leads to the second point. How safe is modern cataract surgery? I would like Dr. Luca, do you remember when cataract surgery was done 5 years ago compared to today? What are you most excited about in terms of safety for our patients?
So we can
about 5 years.
Yeah, we can differentiate from phacoemulsification and the femtosecond assisted cataract surgery. I think also phacoemulsification is safer between 5 years ago because phacoemulsificators increased their potentiality, and you can use a smaller incision. And with the new kind of phacoemulsificator, you can have a better control of intraocular pressure during the surgery, so the less fluctuation of the anterior chamber. And if we compare with the femtosecond cataract surgery, we started a lot of years ago, eight years ago with Flex, and we started in the pre-soft fit era. That's to say, without the contact lens fitting, the docking was more complicated, more prolonged. It was also OCT guided, but the resolution was very low, and the docking was not so fit, so good. So there were a lot of bridge in the capsulotomy. So we had difficulties, and sometimes the anterior capsule have a little tag, and during the surgery you had a very good surgery, but you had with the fluctuation you have an opening of the anterior chamber and the complication due to the anterior capsulotomy. So you can use very low ultrasounds because you use the femtosecond energy to for the lens. But the results are very more safe than 5 years ago, of course, also especially with the femtosecond cataract surgery. But of course, complications can happen in each surgery, so you have to educate the patients. And sometimes the worst thing I think can happen if you put a multifocal IOL in the first eye and you have a complication, you have to speak with the patient what you have to do with the second eye. So if you put because you cannot put a multifocal IOL if you have vitreous, so it's very difficult. But of course, so complication can happen. We explain also always to the patient. We will put if we have not complication, we will put this lens or this other lens. But in general, if they know what they can have, they appreciate more because you explain everything before, and if they have a problem, they already knew that they have a problem. If you say before the surgery will be excellent, you have not symptoms, the patient, even if he is more than 20/20, but after the surgery has, for instance, a dry eye, he say to you, "Oh, I am not happy because before the surgery my eyes were clean, no dry eye. Now I see the." Yeah,
you're getting ahead of me, Dr. Guali. Thank you. That's something that I wanted to talk about later on as well.
Okay.
I do want to emphasize something that you mentioned today, and that is that with the newer technology, cataract surgery has never been as safe as it is today. And also with the new technology, we have better ways of understanding what our patients expect. We have better ways of communicating that. We have better ways of training, which maybe the UK is one of the best examples of how newer technology, newer learning methods have also helped us to achieve the best rates and complication rates in history. Right now, if you go and see at the evidence, you'll see that in most places around the world, you see fewer complications and you see better ways of handling those complications. Thanks, Dr. Guali. So our next question is, how good is cataract surgery really? How how good is it at achieving the outcomes that we're looking for? How predictable are our outcomes? And here I would like to ask Dr. Darcy, if you had a chance, or if you had to, would you have cataract surgery done on yourself today? Yes, no, why? What would you?
Yeah, without doubt, without a shadow of a doubt. I think now with modern technology, with the ways of, I think the safety thing, and also the thing you were talking about just before there, actually starts before the patient gets into the operating room, with the training and using simulation to train people so that actually reduce the complications before people have even started operating on human eyes. But then also having the pathways and having the technology of the measurements, so you can reduce measurement errors, you can reduce what we would call in the UK never events by putting the wrong lens in, because you've got all of that information ready at hand, and you're not having transcription errors moving information from one computer system to another computer system and onwards and forwards. So I think I'll just add that into before. But, you know, would I personally have cataract surgery, or would I have lens replacement surgery even if I was presbyopic with a trifocal or multifocal? Yes, without a shadow of a doubt. No questions at all. And I think that that's a really important thing. And I say that to my patients. And look, my business partner's just done my auntie's about to do my mother, and he's putting trifocals in both of them and their family members. And so, you know, do as you say and do as you do, sort of thing. But I think that the technology today is excellent. The outcomes are predictable and becoming more and more predictable, and patients are generally very, very happy with their outcomes.
I couldn't say it any better. And I'll just leave that slide for a few seconds so you can just read it again and see everything improves with cataract surgery. So our last question is satisfaction. What makes our patients happy? And I would like to open this question to the whole panel. Can you share with us a small, quick tip? What makes your patients happy? But first, just give me a second. So yeah, what makes our patients happy? Maybe Dr. Luis Vega from Spain can help us with this one.
Sure. I think, of course, 2020, as you say here, it's one of the clues, but I think it's very, very important that you explain what the patient is going to find after the surgery. I think that's one of the clues for the patient satisfaction.
Fantastic. So explaining to the patient what Dr. Gualdi was saying as well, about talking to the patient beforehand really helps. But I would like to get a little bit more into this. We've mentioned it before. Is their vision or is the surgery the only thing that matters? What else do you see in your clinics that matters as well? I'll give an example. Dr. Kretz is raising his hand, so I'd like to go with him right now.
I think setting expectations is what really makes your patients happy. If a patient is afraid, you need to set the expectations that it will be painless and that they can walk out seeing. Many patients are still afraid they will get blind. So I do it in topical anesthesia. I don't patch the eye and I let them walk out seeing, and they are happy with no relation to the vision at that moment. I think you have to find individual expectations for the patient and what that patients need. If it's a patient you just have to like care about because they're afraid, or if it's a patient that is feeling that his visual acuity has decreased, that has nighttime problems. And if you set those expectations right, you have a far higher percentage of happy patients.
Fantastic. So setting expectations, talking to your patient and educating your patient. Dr. Gualdi, anything you'd like to add?
Yeah, I think me too. I think the expectations are the most important thing, because for instance, if you have a very demanding patients, you don't suggest multifocal IOL because they have a lot of expectations.
Excellent. Dr. Darcy, I see you raising your hand.
Yeah, so I completely reiterate what they've just colleagues have just said there, but I think the other thing is the communication as well, which you touched on. And the important thing there is communication pre-operatively with the patient beforehand, setting the expectation, but also post-operatively. And interestingly, as long as you communicate effectively with patients that have complications can often if you deal with them correctly and transparently, actually leave the happiest patients. As long as you show you care and you follow them through and you actually ensure that they end up with a good outcome following that complication, then actually they can leave the clinic being the absolute happiest patients. So communication is really key to this.
Fantastic. Dr. Marabe, I wanted to give you the last word on this. What do you do to make your patients happy?
Yes, I also agree that everyone's expectation is very important, It's an important factor. But the visual acuity is important. The quality of visual acuity also is important. And I would add very shortly the post-op symptoms. Some of the patients complain for a dry eye syndrome, for example, dry eye symptoms. Yes, I agree that talking with them and helping them to overpass this, I don't know, maybe 1 or 2 months post-op while they still have some symptoms, be with them, talk to them and help them with consultations or with advices or with some treatment, make them happy. So they really want to see that the doctor still takes care of him or her after the surgery.
So I would like to summarize part of what we said for satisfaction in one phrase: bedside manners. Our bedside manners matter, and this is what gives us, this is what allows us to give a special extra to keep our patients happy. And what the Cochrane review said in that evidence was that the patient's expectations for lens independence is one of the highest factors in satisfaction. So if we can educate and motivate our patients, we'll be able to select better patients and to have happier patients. So Ivo, that's it for the Academy today.
And do you have an unhappy patient, follow him and speak to him and see him continuously. That's very important.
Thank you, Dr. Luis. That's absolutely important. And how do we measure satisfaction? We could just get into this for another time, but thanks a lot. That's
hours about that. I hope you can see what the journey it's about. We first talked about that clinic and every touch point with the patient. There's a lot of evidence, many amazing insights. Thank you so much to the panel. And now let's go to the third part. Okay, we believe that this is very important. We believe that with more technology, we're every time having better outcomes, have better diagnosis, better treatment, and our main role is to educate and to communicate with our patients. We're talking a lot about that, and there is a lot of things that maybe we don't know or we don't master during our careers. So in this case, we have Shemaine that is gonna share with us amazing insights, and let's then discuss with the panel to see how we can improve that communication and education.
Excellent. Thank you so much, Ivo. Just want to confirm that you can see the presentation. Can you confirm that you can see it?
Yeah, you can see it.
Yeah.
Excellent. Well, Ivo, thank you so much to you and Asaso and Ophthalmo University for the invitation to present on such an important topic. It's really been a lively and educational conversation, and what we need to do as a community is really just support our patients in the cataract journey. I work with this doctor in Brazil, and what I love about her that she says all the time is that one day we also are going to be needing the cataract surgery, so we have to think about that as well. So, when many people think of a brand as just a product, so when we think about Apple or Nike or Rolex or BMW, any of our brands that we love, that's what we think about. But what I really wanted to share today is that you, as a surgeon, you're a brand. It's your personal brand. And, the fact that your clinic, your office, your surgery center, they also have a brand. I love seeing today Dr. Florian with his, the brand that he's kind of bringing with the beer and just having that personal touch. I just want to confirm real quick, can everybody still hear me okay? Because I'm getting some background noise, so I just want to make sure that I'm okay.
Loud and clear.
Yeah. Okay, perfect. So really today's topic, a patient's cataract journey, can really start at any time. So I want to give you some examples. Sometimes to think about a patient's view, you're also a patient, right? So let's say, your elbow hurts or your knee hurts. Like what are some of the things that you would do? You start to Google and you're like, my knee hurts this way. The same thing also happens for a patient, right? When they get to the age and they start having cloudy vision, they may Google that. They may Google, cloudy vision, and they start kind of going online to kind of understand what's happening to them. Or, a friend tells them that they're having cataract journey, and so that cataract surgery. So then that conversation kind of starts for them, and they start to think about themselves and or their husband or their wife, and when that's going to happen for them. Or it could be another doctor. So it could be yourself as the ophthalmologist letting someone know that they have cataracts, but it also could be an optometrist. It could also be during their annual checkup, right? Their general practitioner just lets them know, hey, it might be time to go see your ophthalmologist or your optometrist for a referral for cataract surgery. So you have to think about those touch points for the patient, and think about, what they do at that time. So a lot of times, right, when you think about it, they start talking to their husband or their wife, or some will talk to their son or their daughter. Some have, brothers and sisters that are their same age. And so they'll talk to them about, the doctor just shared with me that I have to have, cataract surgery. They have friends. So you have to think about that in a holistic way. And what do they do during that time? So when they start to look online, I think the question to go back and reflect on is, what does your brand tell them? So, well, hopefully it tells them that, you're trusted, you're caring, and most importantly, that you have options for them. So I want to give you some really high level tips so that you can go back and look at your website and look at your social media and make sure that your brand is giving the patients that are looking the confidence they need, because that is exactly what they need, the confidence to go ahead and pick up that phone or fill out your form online and make that appointment. So if there's only one takeaway that you take away from what I'm going to share with you today is, I would say it's simplicity. So when we're talking about website or social media, simplicity is really important. Simple is better. And I think that for anybody really, when we're talking about patients or just anything, you want to make sure that the website can be seen on all platforms. I think it can be extremely frustrating for someone if they're Googling on their phone or on their iPad and they stumble across your website as one of the first options, and it's kind of hard to see on the iPad or the phone. So make sure that your website can be seen on all platforms. They say, content is king, but one of the hot topics I would say that is really kind of coming out right now is context is queen. And so when we talk about options, this is also a time for you and your practice to really shine. If you're the type of surgeon that really has pride in the fact that you correct astigmatism, look at your website and your social media. Do you have things where you're explaining in simple terms, what is astigmatism? And astigmatism is something that you treat at your practice or at your clinic. Do you want to explain that with some IOLs? Of course, they may not know what IOLs are, right? So you might have to use language like intraocular lenses and explain what that is, that they can have spectacle independence, so that might be something that you want to explain. You want to let them know that you have options and that setting an appointment with you is really important so that you can discuss what options you have for them. Now, videos are really hot, and what we've seen trend-wise is that videos provide site stickiness, and what that means is that people are going to be spending more time on your website because videos are really attractive. So it could be animations, it could be in the form of testimonials. You can have, patients talk about the care that you gave them and how, they now see 20/20 or better, et cetera. Testimonials can also be in the written form. Again, that gives patients confidence. They look for those things and they really want to see those testimonials. That's also something that's really big right now. And when we talk about COVID, right, that we're still all kind of facing COVID, it would be good for your website to have a COVID corner, for example, to really talk about what are your practices at your office for COVID, what can they expect, it's safe, all the steps that you're taking in your clinic. So make sure that you have something about that. And I think also downloadable items. So if you did have people come beforehand and fill out a lot of forms, you know, why not have them printed? They can fill out those forms at the comfort of their home. And when they show up, they already have all those forms. You're reducing time in your office and that contact. As well, one of the things that I love best is like a lifestyle questionnaire. So if you don't have a lifestyle questionnaire, that might also be something great, because that will allow you to talk to your patients about what options they have. So for example, you know, do they knit? Do they golf? Do they spend a lot of time on Netflix, on their iPad? You know, what are some of the things that they're doing so that you can present the best options for them? It's really going to help move the conversation along in terms of why you're recommending a trifocal or why you're recommending a toric lens. They'll hopefully have read about that a little bit before. So hopefully those are some things that can really help you. And I think with more and more of today's patients, and when we definitely think about the future and what's coming, you must really take the time to like review your website, review your social media. But then in the end, you know, you're all ophthalmologists, and I understand that we don't want to make, you know, social media, you know, designers out of, and website designers out of everybody here, but that's okay. I mean, consider hiring a professional to help you manage your website and your social media. I think in a lot of countries you can find and Google the right person to help you do that. You may want to bring that person in along into your clinic. And so just really kind of think about that and consider that in creating a website and a social media. And lastly, I would say in terms of my social media takeaway tips, again, it goes back to, you know, that consistency. If you are going to have a chat feature on your website or on your social media, make sure that you're responding in a timely manner. I think nothing can be more frustrating to someone when they chat you and they don't hear back from you from days. They're definitely going to end up going somewhere else, and they're going to have a negative impression. So when we talk about branding, we want to make sure it's always a positive impression. So make sure if you have a chat feature that you're responding in a timely fashion. And again, you can have someone in your staff that's dedicated to making sure that that's done. Also, social media, you know, videos, a great place to put testimonials. Always ensure that you, in the social media aspect, you know, when it comes, consider what channels are best for your practice. There's a lot of channels, right? Facebook and Instagram, and now even TikTok. I've seen on the refractive side with LASIK, just a great use of TikTok for those millennial types that are wanting to get rid of their glasses and have LASIK. So something for you to consider. But, you know, videos and educational content is really key, and separate your personal from your private as well. That's another tip. So overall, just, you know, make sure the brand that you create for yourself and for your practice is brilliant. And it's really been a pleasure just giving you some really high level tips so that you can elevate your own personal brand and the brand of your clinic. So thank you so much for your time, and I'll have a shameless plug here for our Alcon Experience Academy, that if you have not had a chance to visit the Alcon Experience Academy, please go on, register. We have over 800 educational videos for you. So thank you so much, Ivo, everybody at Ophthalmo University for this opportunity.
Thank you. Thank you. There is a lot we can learn from, you know, from industry, from everybody. I think this is an amazing place to learn everybody from everybody. I would like to say, like what Jeff Bezos says, right? That branding is what people say about you, but when you are not in the room, not when you are in the room and everybody, you know, it's nice. It's about when you're not. What's your personal brand? I think that's very important, and we need to keep that in mind every time. I'm going to ask the panel about that. First, I'm going to say thank you to all the platforms that are transmitting this. We're in Zoom, we're in YouTube, we're in a web portal. Alcon Experience Academy, it's putting this in their portal as well, and also ESASO in their amazing and huge community. I want to thank many people, for example, Andres from Spain, Ahmed from Somalia. We have Ana Cristina from Braga, Portugal. We have people from Toronto, Canada, Sihin Lupier. We have people from South Africa because of the timeline, right? It's amazing. Irina from Russia and Kazakhstan. people from Mexico City, Morocco, Bosnia and Herzegovina. I wanted to thank these guys. And there is many people in the chat already guessing. This is the final, part of the event. And here behind these curtains, we have the clinic. What do you guys think? I'm gonna ask the panel. What did you think, Florian? This clinic is from where?
Well, you gave us a hint, it's from Spain. So I guess it's Louis' clinic because he's sitting here with us. And I do believe that you did say it in the very beginning as well, that it's his clinic.
That's
I remember rightly.
Okay, so if we open the curtain, yes, that's Instituto Oftalmológico Fernández Vega. Luis, it's a great friend, has a big family about doing stuff about ophthalmology for a long time now. And Luis, I think it was an amazing video. We're going to show it again because it was a little bit cut. Tell us a little bit more about, in this cataract journey, more specifically, what are the points that are important for you that colleagues can learn from you?
Thank you very much for choosing us as the Mass Clinic, and you are all invited if you want to come and visit us. Well, I think, as I said before, it's very important for us to receive all the tests done before, and we do a lot of tests. And when they call to the clinic, as you saw in the video, we already tell them that they are going to stay in the clinic between 2 or 3 hours. Okay, now with the COVID it's a little bit different because we have less time and obviously less space. But usually a normal visit takes around 2 and 3 hours because we want to have all the parameters done, of course, topography, biometry, anterior segment OCT, but also the study of the posterior of the retina, dry eye. So I think it's very important to have everything done. Also, we have some patient education, as you see in the video, where we give the patient all the information about the lenses, about how is going to be the surgery, how is going to be the anesthesia, how is going to be the follow-up. So when they arrive home and they want to tell their family that nowadays sometimes they can't come with them, they have all the information to tell them, and they know all the answers that they can have, or all the doubts that they can have. And even if they have doubts afterwards, we have like a call clinic where they can speak with us, and we can be very precise to respond all those questions.
Perfect. Thank you very much, Luis. Very complete. I think you are seeing what we wanted to do. I think we did it in a very good timing. Now we talk about this new concept about the patient perspective. We talk about what happens in a clinic. We talk about what evidence do we have. We talk about how to communicate more effectively and efficiently. And I would like the panel to say goodbye to the audience with one takeaway, especially from the patient perspective. What can we say other colleagues? Let's start with Florian. What can we say to other colleagues to have the practice they want, right? To have the brand they seek, and to, of course, improve outcomes and patient satisfaction?
Well, don't let your work blind yourself, and keep your patient in the focus. Ultimately, you want to have that the patient is happy, and not that you're satisfied with doing anything fancy. So just always take care of your patient's demands. And I really think that is one of the key messages for success.
Very good. Kyron, what will be your advice?
Yeah, so I think exactly, it's similar to that, but I think transparency to the patient, so that they're every step of the way, they really understand exactly what's happening, what's going on, and what they can expect from the surgery and from you, and from aftercare right the way through the patient journey.
Perfect. Dr. Aboraru?
I would have two advices. One is to my colleagues. One is stay close to your patient. And the second one would be, if you missed this webinar, you can see it later on YouTube, and you will learn how to do.
Very good one. Very good one. Yes. And follow Ophthalmo University. Luca, tell us, what do you think?
Yeah, so do as more exams as possible to the patients to exclude any pathologies. Explain him everything as more as possible, the surgery and the pathologies, and with education if it's possible, and especially be available in every moment. So by email, by phone, if of course he call and you cannot answer, you have to recall him and explain the problems. As Dr. Vega told him, it's very important to be present during the day to all the questions and the problems of each patient.
Very much. Well, we want to thank the panel. We want to thank all the people who are behind this. Shemaine, thank you so much for the support to make this come true. We have been working for a couple of months in this, and I think people are very happy because of the comments. There is a huge team behind this, design team, Lisandro, Andres, so many people behind this event to make it perfect. We want to invite you to webisode number 2. We thank you very much for your time. And well, I would love to say just goodbye to the panel and hope to see you soon. This is your house in Mexico City, and we love to have you here back.
Bye.
Thank you. Bye. Bye.
Bye-bye. See you soon.
Bye.
See you soon, guys. Thank you,
Bye-bye.
everybody.
Hi, thank you, everyone.
Thanks, everyone.
Thank you. Bye.
Bye-bye.